Bismillahirrahmanirrahim. Quote of the day, and be patient for indeed, and Allah does not allow to be the loss the reward of those who do good. Today, the topic of presentation is natural history of disease, ways of expressing prognosis. I am Dr. Abhay Iqbal, PGR Community Medicine, and I am presenting under the supervision of Professor Dr. Saira Akhtar. Learning objectives of today's presentation. Natural history of the disease, case fatality, 5-year survival, observed survival, median survival time, relative survival time, two approaches for calculating observed survival over time, the life table approach and Kaplan-Meier method. Recent advances and MCQs at the end. Learning outcomes. By the end of this presentation, participants would be able to compare 5 different ways of describing the natural history of disease, case fatality, 5-year survival, observed survival, median survival time, and relative survival time. And to describe two approaches for calculating observed survival over timetable approach, over time, and Kaplan-Meier's method. Natural history of the disease. The natural history of the disease refer to the progression of the disease process in an individual over time in the absence of treatment. These are the cases, preclinical case, clinical phase, and outcome. First of all, biological onset of the disease, then pathological evidence of the disease if found. Then signs and symptoms of the disease appear, patient seek medical care, uh, diagnosis of the disease made, and treatment given to the patient. And this is the outcome: either disease cure, control, disability occur, or death. Now, ways of expressing prognosis. 5 approaches to express prognosis. Number 1, case fatality rate. Number 2, 5-year survival rate. Number 3, observed survival rate. Number 4, median survival rate. Number 5, relative survival rate. Number 1 is case fatality rate. Case fatality rate is the proportion of individuals diagnosed with a particular disease who die from that disease within a specific time period. It is a measure of disease severity and is commonly used during outbreak or epidemic. Key features of case fatality rate is measure severity of the disease expressed as a percentage useful during the epidemic or outbreak. This is the formula of case fatality. Case fatality rate is equal to number of deaths due to the disease divided by number of diagnosed cases of the disease multiplied by 100. Number 2, 5-year survival rate. Definition of 5-year survival rate is the percentage of people who are alive 5 years after the diagnosis of disease. The term frequently used in clinical medicine, particularly in the treatment of cancer and chronic disease. Formula of 5-year survival rate is 5-year survival rate is equal to number of patients alive after 5 years divided by number of patients diagnosed multiplied by 100. Despite the widespread use of 5-year interval, it should be pointed out that there is nothing magical about 5 years. Certainly, no significant biological change occur abruptly at 5 years in natural history of disease that would justify it, or as an end point. However, most deaths from cancer typically occur during this period after the diagnosis, so 5-year survival have been used as an index of success in cancer treatment. There are some problems, 5-year survival. One problem with the use of 5-year survival has become more prominent in recent years with the advent of better screening programs. For example, a woman who had a biological onset of cancer in 2005, because of the disease was at that time was in subclinical stage, she had no signs and symptoms. She felt a lump in her breast in 2013 and precipitated a visit to her physician who made the diagnosis. And then patient undergo mastectomy in 2013, but she died at 2015 due to metastatic cancer, as measured by the 5-year survival, which is often used in oncology as a measure of whether therapy has been successful. But in this case, this therapy is not successful because patient survival only for 2 years after the diagnosis. Now let's imagine if this woman lived in a community where there is an aggressive breast cancer mammography screening campaign. As before, biological onset of the disease occurred in 2005. In 2010, she was identified through the screening as he have a small breast in her breast. She had surgery in 2010, but she died 2015 because she survived for 5 years after the diagnosis. She would be now identified as a therapeutic success in 5 year survival. Death still occurred in 2015. Patient life was not lengthened by the early detection and therapy, but the interval between her diagnosis and the death increased through earlier diagnosis. So the interval between the earlier diagnosis in 2010 made by possible screening test and the later usual time of diagnosis, that was 2013, that this time is called lead time. What is lead time? Lead time is the interval between the early detection of the disease and the point at which the diagnosis would made have been made based on clinical sign symptoms. This is the benefit of the program must be seen in the term of outcome. A is the outcome of the disease. B is the outcome of expected when the disease is detected at the earliest possible movement, where B and A is the benefit of the program. This in this diagram, this shows the first possible point where the diagnosis is made after screening, and this is the usual time of diagnosis through the clinical sign symptom. This is called lead time. Another problem with 5 year survival is that if we want to look at the survival experience of a group of a patient who were diagnosed less than 5 years ago, we clearly cannot use criteria because 5 years of the observation are necessary if the patient to calculate 5 year survival. Therefore, if we want to assess a therapy that was introduced less than 5 years ago, 5 year survival is not an appropriate measure. Now the uses of 5 year survival. 5 year survival can be used to compare the effectiveness of treatment. It is more useful in aggressive disease that have shorter life expectancy, such as lung cancer, and less useful in those cases with long life expectancy, such as prostate cancer. Improvement in the rate are sometimes attributed to improvements in diagnosis rather to improvement in prognosis. To compare the treatment independently from the diagnosis, it is better to consider survival from reaching a certain stage of the disease or its treatment. Number third is observed survival. Definition: observed survival is the actual proportion of the patient still alive after a specific period following diagnosis or treatment, regardless of the cause of the disease. Now, rationale for the life table. Another approach to qualify prognosis is to use actual observed survival of the patient follow over time based on knowing the interval within which the event has occurred. For this purpose, we use life table. This is the life table hypothetical study of the treatment result in the patient treated from 2010 to 2014 and followed to 2015. This is the year 2010 where these patient enrolled. In 2010, 84 patients enrolled, and these are the patients that are enrolled in later year. So if we rearrange this table, we see that in 2010, 84 patients enrolled for the treatment. After first year, 44 people alive, and after the end of the second year, 21 people alive, and after third year, 13 people alive, and so on. In the same way, these are the patients which are enrolled later years. Now, what is the probability of surviving for 1 year after the beginning of treatment? So, to answer this, we divide the total number of the patients who were alive after 1 year, that after the initiation of treatment, that is 197, to the total number of patients that are enrolled for the treatment, that is 375. So we can calculate the probability of surviving the first year, that is equal to 197, that is the people survived after 1 year of treatment, that is 197, divided by 375, that is the total patient enrolled, is equal to 0.525. Next is, what is the probability that having survived the first year after the beginning of the treatment, the patient will survive the second year? To find out this probability of surviving the second year, we divide 71, that the total patient that are survived after the second year, 71 divided by 197, the patient which are survived after the first year, minus 43 patient. 43 patient are those patients we have no further information because they were enrolled later year. So we subtract that 43 is equal to 0.46. Given that a person has survived to the end of the second year, what is the probability on average that he or she will survive at the end of third year? So we see 36 are the people who are survived after the end of third year, divided by 71 survived the second year, and we subtract these 16 because we do not have the information of these 16 because they are enrolled late in the study. So the probability of surviving the third year is equal to 36 that are survived after third year divided by 71 that are survived after second year minus 16 whom that we do not have any data is equal to 0.655. So this is the table of probability of surviving each year of the study. P1, the probability of surviving the first year, a total number that are survived after first year divided by the total number of the patients that are enrolled in the for the treatment. P2, probability of surviving the second year given survival to the end of the first year. There are 71 that are survived after the second year divided by 179 that is survived after first year minus 43 whom we do not have any data. In the same way, P3, P4, and P5. Next is cumulative probabilities of surviving different lengths of time. Probability of surviving first year P1 is equal to 52.5%. Probability of surviving second year, we multiply by probability of surviving first year multiply by second year, so we get surviving 2 year, that is 24.2. In the same way, probability of surviving third year, we multiply these three probabilities and we get the surviving of 3 year, that is 15.9, and in the same way 4 year and 5 year. Calculating the life table. Let's now view the data from the example in the standard table in which they are usually present for calculating a life table. The columns are following. Column 1, the interval since the beginning of the treatment, that is first year, second year, third year, fourth year, and final year. Column 2, the number of the patients that are who are alive at the beginning of the each interval. And column number 3, the number of the subjects who died during the interval. And column number 4, these are the subjects who withdrew during the interval. This is the number of the study subjects who could not follow for the study period, either because they were lost to the follow-up or because they are enrolled after the study started. So this is a calculation of the life table. These are the four columns, same 4 columns. Now, column number 5, effective number exposed to the risk of dying during the interval. So we subtract column number 4 from column number 2, and we get these values. To get proportion who died during the interval, we divide column number 3 to column number 5, and column number 7, the proportion who did not die during the interval. So we subtract column number 6 from 1, and we get this value. Cumulative proportion who survived from the enrollment to the end of interval, that is cumulative survival. Next is the plan measure method. The plan measure method, it is also survival analysis method that use exact time when event occurred. In Kaplan Meier method, predetermined intervals such as 1 month or 1 year are not used. Rather, we identify the exact point in the time when the death or event of interest occurred so that each death or event terminates the previous interval and new interval, and a new row in the plan Meier table is started. The number of persons who die at that point is used as a nominator, and the number alive to up to that point is used as a denominator. After any withdrawal that occur before that point are subtracted. So this is the example of hypothetical sample hypothetical study. Six patients were studied. These six patients were studied to whom four died and two lost. The death occurred at the 4, 10, 14, and 24 months after the enrollment of the study. Now, this is the table of the calculating survival using the Kaplan-Meier method, in which column 1, the time for each death from the time of the enrollment. Column number 2, the number of patients who were alive and followed at the time of their death, including those who died at that time. This is column number 3, the number who died at that point. Column number 4, the proportion of those who were alive and followed. Column number 2, divided by who died at the time. That is column. So we divide column number 3 to column number 2 to get this proportion. Next is column number 5, the proportion of those who were alive and survived. So we subtract column number 4 from 1. And this is column number 6, the cumulative survival, the proportion of those who were initially enrolled and survived to that point. Note that the data are plotted in stepwise. This is the stepwise data rather than smooth slope, because after a drop in the survival result, each death survival then remain unchanged until the next death occurs. Application of Kaplan-Meier method. When information on exact time of death is available, the Kaplan-Meier method clearly makes fullest use of information because the data are used to define the interval. Although the method is well suited to study well with small number of patients, today computer programs are readily available that make this method applicable to the large data set as well. Many of the study is published literature now report data on survival using the Kaplan-Meier method. This is the comparison between the life table and the Kaplan-Meier survival. In life table, actual the sensor data and cumulative probability calculation in Kaplan allow the sensor data and cumulative probability calculation. A life table is a time dependent, whereas in Kaplan-Meier survival it is event dependent. In life table, unreliable in small data set. In Kaplan, reliable in small data sets. Uniformity assumption, uniform timing of sensing assumed, while in Kaplan Meier survival, no assumption is made about the timing of sensing. Number 4 is median survival time definition. Median survival time is the time in which 50% of the patients in the study group have died and 50% are still alive after the diagnosis of the treatment. Median survival offer two advantages over mean survival. First, it is less affected by extremes, whereas the mean can significantly affect by even a single outlier. Second, if we use mean survival, we would have to observe all the deaths in the study population before the mean could be calculated. However, calculating the median survival, we would only have to observe the death of the half of the group under the observation. This is the mean survival time versus the median survival time. Mean survival time in Kaplan-Meier. Mean survival time is estimated as the area under survival curve. This is area under survival curve in the interval to T max. Whereas in median survival is the length of the time that 50% of the study population survive. Next is relative survival. Relative survival is the ratio of the observed survival in a group of patients to the expected survival in a similar group from the general population without the disease. It helps estimate how much the disease itself produces survival by removing the effect of other causes of the death, like age or accident. Relative survival, this is the formula. Relative survival is equal to observed survival in the people with the disease divided by expected survival if the disease were absent. So, does the relative survival really makes any difference? When we look at the older age group, which have high rates of mortality from other causes, there is a large difference between the observed and the relative survival. However, in young persons who generally do not die or of an other cause, observed and relative survival for the cancer of colon and rectum do not differ significantly. Now, recent advances. This is an article assessment of median and mean survival time in cancer clinical trial. Clinical trial often report the estimated median survival time to facilitate interpretation. However, the median makes limited use of survival curve, focusing on the center of exclusion of the other information. Concern exists about the median stability as measured by the width of CL in trial with few event or limited follow-up. The median survival may not be reached. In contrast, the restricted mean survival time provide clinically interpretable and global summary of survival and may be more stable than median. Instability can be obscured the clinical interpretation of survival estimate. Wide CL suggests that the true estimate fall within the broad range of possible value, creating uncertainty and limiting the usefulness of such survival estimate for clinical decision making. To determine the relative stability of the estimate mean and median survival time, we conduct a part. In the disease, we analyze the reconstructed individual patient level data from the plan measure from a comprehensive collection of 203 phase 3 cancer clinical trial. This is another uh, uh, individual patient data from Kaplan measure, reconstruct individual patient data from published Kaplan measure survival curve. Background: when applying the secondary analysis on published survival data, it is critical to obtain each patient's raw data because the individual patient data approach has been concerned as the gold standard of data analysis. However, research often lacks access to individual patient data. We aim to propose straightforward and robust approach to obtain the individual patient data from the published survival curve and with user-friendly software platform. So the conclusion is individual patient data from the Kaplan measure has greatly flexibility and accuracy to reconstruct IPD from published Kaplan measure curve, which different shapes. We believe that our package and shiny application will greatly facilitate and potential use of quality IPD and advanced use of secondary data to facilitate informed decision making in the medical research. Now on to the MCQs. MCQs number 1, what does the natural history refer to? A, the genetic origin of the disease. B, the treatment of outcome of the disease. C, the disease progression with effective treatment. D, the impact of lifestyle on disease prevention. E, the progression of disease over the time without treatment.
E. E.
Yes, E is the right option. What is the key feature of the case fatality rate? A, it expressed in year. B, it measures the effectiveness of treatment. C, it is commonly used in chronic disease. D, it measures the severity of the disease and expressed as a percentage. E, it applies to non-communicable diseases.
D.
D.
Yes, D is the right option. It measures the severity of the disease and expressed as a percentage. MCQ number 3, during the outbreak of the novel viral infection, the community of 10,000 people, 800 individuals were diagnosed with the disease. Out of these, 120 died within the 3 weeks of diagnosis. Public health officials are now assessing the severity of the disease to guide response strategies. Based on the information provided, which conclusion is most accurate regarding the case fatality rate and its application? A, the case fatality rate is 12%, suggesting the infection has low transmission rate. B, the case fatality rate is 15, indicating a mild disease that required no urgent public health response. C, the CFR is 10%, implying the infection is less deadly than other known epidemic. D, the CFR is 15, highlighting the need for rapid medical and containment intervention. E, the CFR is 1.2, suggesting only a small proportion of the population is at risk.
Delta.
D.
Yes, D is the right option. This is the explanation. Number of deaths, that is 120 divided by 800. The diagnosed cases multiplied by 100, that is 15. So D is the right option. 15%, highlighting the need for rapid medical and containment intervention. Now, MCQ number 4. In the survival analysis, censoring occur when a patient dies from the disease of interest. B, a patient completes 5 years of follow-up. C, a patient's exact survival time is unknown due to loss to follow-up and or studies. And D, the Kaplan-Meier curve reaches zero. E, a patient receives treatment during the observation period.
Charlie.
B.
Yes,
B.
no. C is the right option. A patient's exact survival time is unknown due to loss of to the follow-up or the study end. MCQ number 5. Which scenario best demonstrates the limitation of using the 5-year survival rate in evaluating cancer treatment? A, it includes patient loss to follow-up. B, it overestimates benefit if diagnosis is made earlier but survival time is improved. C, it includes patient with comorbidities. D, it underestimates survival in pediatric cases. E, it only applies to the hospital-based cases.
Beta. B.
Yes, B is the right option. MCQ number 6. A researcher analysts want to evaluate cancer survival in two groups using life table. Group A start with 300 patients and 180 survived the first year. What is the probability of surviving the first year? A 0.45, B 0.50, C 0.60, D 0.70, E 0.90.
C. Charlie.
0.60.
D is the right option. 180 patients that are survived after the first year divided by the total patients that are 300 patients. MCQ number 7. A national screening program detects cancer 3 years earlier than the usual clinical diagnosis. However, survival time after the diagnosis increases while the actual lifespan remain unchanged. What should the public health term conclude about the program's effectiveness? A, the program increased overall survival time. B, the program reduced case fatality rate significantly. C, the program introduced lead time bias without improving outcome. D, the program cured cancer at early stage. E, the program failed due to low 5-year survival rate.
C.
Charlie.
Yes, C is the right option. MCQ number 8. Which of the following have a good index of severity of short-term acute disease? A, case-specific disease. B, 5-year survival. C, case fatality. D, standardized mortality ratio. E, median survival time.
E.
No, C is the right option. That is case fatality. MCQ number 9. In which of the following situation is a life table approach more appropriate than Kaplan-Meier method? A, when exact timing of event is known. B, when survival probabilities need to be updated with every event. C, when data are grouped into large fixed time interval. D, when calculating the hazard ratio. E, when comparing multiple treatment groups with small size.
C. Elf.
Yes, C is the right option. MCQ number 10. A cohort of 500 breast cancer patients has a 5-year observed survival rate of 80%. The expected 5-year survival in the general population is 90%. What is the relative survival rate and what does it apply? A, 70%, the death significantly reduced life expectancy. 88.8, only minor impact of disease on survival. C, 90% survival is equal to the general population. E, 88.8, after adjusting for other causes, disease impact is moderate. E, 55%, high disease specific mortality. D is the right option. Relative survival, the formula is observed survival divided by expected survival multiplied by 100. The observed survival is 80 divided by expected survival, that is 90, so 88.8%. Right option is 88.8% after adjusting for other causes. Disease impact is moderate. This is the MCQ scheme. This is the YouTube channel where this video will be uploaded. And thank you, everyone.
Thank you.